What if I told you that a single cold drink can trigger more damage in your body than you realize? Most people see soft drinks as harmless refreshment, but inside your body, this sugary liquid starts a chain reaction that affects your blood, organs, and metabolism within minutes of the first sip. Cold drinks contain high amounts of sugar, artificial sweeteners, phosphoric acid, caffeine, and chemical flavoring agents. When this mixture enters your bloodstream, the body treats it as a sudden chemical overload. The liver is forced to work harder to process the excess sugar, while insulin levels spike rapidly. Within minutes, blood sugar levels rise sharply. To control this surge, the pancreas releases large amounts of insulin. Repeated insulin spikes over time can lead to insulin resistance, increasing the risk of type 2 diabetes, obesity, and metabolic disorders, even in young people. Phosphoric acid found in many soft drinks interferes with calcium absorption. Over time, this weakens bones and increases the risk of fractures. At the same time, sugar and acids attack tooth enamel, leading to cavities, tooth sensitivity, and long-term dental damage. High sugar intake causes inflammation in blood vessels and increases triglyceride levels. This raises the risk of high blood pressure, heart disease, and stroke. Studies show that regular consumption of sugary drinks is directly linked to increased cardiovascular risk. Cold drinks stimulate dopamine release in the brain, creating a temporary feeling of pleasure. This response can lead to addictive consumption patterns similar to other stimulants. Caffeine further increases dependence, making it harder for people to reduce or quit these drinks. Many people believe diet or zero-sugar drinks are safe alternatives. However, artificial sweeteners can still disrupt gut bacteria, increase cravings, and affect glucose metabolism. The label may say zero sugar, but the biological impact is far from zero. The human body does not need cold drinks to function or feel energized. Water, natural juices, and balanced nutrition support real health. Reducing soft drink consumption is not about restriction. It is about protecting your organs before silent damage turns into permanent disease.
One of the biggest misconceptions among students is that soft drinks are simply liquid snacks with no real consequences. In reality, they are chemical combinations designed to override natural hunger and energy signals. When a student drinks a soft drink, the high sugar content forces the pancreas to release insulin in large amounts to control blood glucose levels. This process may seem normal, but repeated exposure trains the body into a harmful cycle. The more often insulin is released unnecessarily, the less effective it becomes over time. For students, this is especially dangerous because insulin resistance does not just affect weight, it affects brain performance. Glucose is the primary fuel for the brain, and when insulin function becomes inefficient, the brain struggles to use energy properly. This leads to mental fog, slower reaction time, and difficulty retaining information. A student may study longer hours yet achieve poorer results, without realizing that diet plays a major role. Another major issue is emotional regulation. Sugar spikes followed by crashes influence mood stability. Many students experience sudden irritability, anxiety, or lack of motivation without understanding the cause. These mood swings are often blamed on academic pressure, but dietary habits silently intensify them. Soft drinks exaggerate stress responses, making exams feel more overwhelming and reducing emotional resilience. Peer culture also plays a role. In schools and universities, soft drinks are often associated with social bonding, shared bottles, vending machines, cafe breaks. Refusing them can feel awkward or unnecessary. However, understanding the long-term cost changes perspective. Real confidence comes from making informed choices, not following habits that harm both health and academic performance. Summary: soft drinks may seem like a small and harmless part of student life, but their effects on the body and mind are far deeper than most people realize. Regular consumption creates sugar spikes that disrupt insulin function, weaken focus, disturb sleep, and reduce emotional stability, while also increasing stress, fatigue, and dependency on artificial energy. Over time, these drinks affect digestion, skin health, confidence, discipline, and academic performance, silently shaping habits that follow students into adulthood. What feels like a short-term boost slowly becomes a long-term disadvantage, interfering with concentration, motivation, and overall well-being. Choosing healthier alternatives is not about restriction or perfection, but about supporting the brain and body during the most important developmental years, building resilience, clarity,